Namaste. I'm Dr. Meenakshi, a family physician working as a AHC consultant at Apollo Noida. And today I would like to talk to you about a very pertinent topic, which is showing some increasing trend, the dengue fever, also known as breakbone fever. And this is a tropical disease caused by dengue virus, and it is transmitted to humans through the bite of infected mosquitoes. Many dengue infections are asymptomatic and produce mild illness. However, on occasional cases, it will be severe and also lead to death. So, the prevention and control of the dengue on the vector control is very important, and there's no specific treatment for dengue, so which is a little problematic. So early detection and proper medical care is important and lowers the risk of fatality in severe dengue. In the epidemiology of the dengue, we have seen that about 100 to 400 billion infections are occurring per year, and about half the population, the world's population, is affected, particularly in the tropical and subtropical climates worldwide, mostly in the urban areas and rather than the rural areas. Semi-urban areas also are included. So the WHO actually observed an increasing trend from 2019 to 2000 also. So there were about more than 5 lakh cases which were observed, and 2023 has shown an increasing trend. That is about 80 countries which are WHO associated regions have shown an increasing trend. So that's why this becomes a very important topic to discuss, with more importantly with the ongoing transmission and seeing this unexpected spike. We are trying to study the reasons for this, and I'll come to reasons for it a little later. So more than about 100 countries in the WHO regions of Africa, Americas, Eastern Mediterranean, Southeast Asia, and Western Pacific showing an increasing new trend. And the more seriously affected are Asian countries and Southeast Asia and Western Pacific. So also new trends are being seen in Europe, Eastern Mediterranean, and South America. The largest number of dengue cases have been reported in 2023, and that is also leading to about 2,300 deaths. So, which becomes very, very important. And in Asia, Bangladesh, Malaysia, Thailand, and Vietnam are showing high number of cases. Dengue virus is an RNA virus, which is from the family of Flaviviridae, which is a genus Flavivirus, and is transmitted by arthropods, that is mosquitoes and ticks, and it's an arbovirus. Dengue virus per se has 4 serotypes, 1, 2, and 4. So, and all of them will show full spectrum of disease. Once one serotype affects a person, he becomes immune to it lifelong. However, he can be affected by the other serotypes also. So it becomes very important also in travelers. I think travelers traveling and tourism having increased, this is one of the reasons which could be leading to this. This is transmitted and spread by this vector, which is a mosquito, Aedes aegypti, and Albopicticus mosquitoes, which are found mainly in some areas. And now they are also found in the dengue naive countries. So the climate change might be responsible. The increasing temperatures and high rainfall and humidity, the fragile health systems in the COVID-19 pandemic, which resulted, has also been contributing to this increasing rise and trend. And also it could be because of political and financial instabilities in the countries. So we see that a person who has had dengue earlier will have a more severe dengue the next time he is affected. So urbanization is important to your population density, human mobility, access to reliable water sources, and water storage practices also. So The community is involved also the knowledge, attitude, and practices of the water storage, plant keeping, and self protection against the mosquito bites. There, we need to actually do a routine vector surveillance and some control activities so that there is some resilience from the community to acquire the disease. And the vectors also need to be controlled. The vector is the mosquito, particularly in new environments and the climate, which is a dynamic change which we observe, which we've been observing over time. So the transmission has been by the female mosquito bites of the Aedes aegypti and also albopicticus, and there can be human to mosquito transmission, and so that is also possible. Once the person is infected, he fly Aedes mosquito will lifelong carry the dengue virus. And there are maternal transmissions also observed, and also other transmission needs which have been seen in organ transplant, organ donation, and blood products, etc. So then, after feeding, the virus will multiply in the mosquito, and it disseminates to the other parts in the tissues and the salivary gland, and then infects the people. So there's an incubation period. The external incubation period is approximately 8 to 12 days, and the ambient temperature is between 25 to 28 degrees centigrade, which we usually see. So these are some of the epidemiological reasons for this. And coming on to the warning signs of dengue virus, there could be abdominal pain, ongoing vomiting, liver enlargement, mucosal bleeding, any bleeding from any of the oral cavities, etc. And of course, laboratory tests which have like a high hematocrit and a low platelet count. We do various serological studies for the lab investigations. The other manifestations could be high fever, severe headache, which is typical of a viral infection, pain behind the eyes, the muscle and joint pains, lethargy, nausea, vomiting, swollen glands, even rashes. So, which of course we see in the different courses of the disease infection. So there are typically three phases: the febrile phase, which is 2 to 7 days, the critical phase, which is about 1 to 2 days, and the recovery phase is 2 to 3 days. So we have to observe, and hospitalization is recommended by the physician on checking out on these terms as well. And of course, the severe dengue cases would be severe abdominal pain. There could be fluid collection anywhere in the body, in the lungs, in the peritoneal cavity, that is the abdominal cavity. So there might be persistent vomiting, rapid bleeding from the gums or any side, fatigue, restlessness, blood in the vomit or stool, being very thirsty, pale and cold, clammy skin, feeling weak and lethargic. So, coming to the diagnostic and treatment, there being no specific treatment for dengue, we need to be very careful and do come to the physician, let them diagnose, and whether what phase of dengue virus, dengue infection it is, whether it's the febrile phase or the critical phase, or leading on to the recovery phase. And the focus is mainly to treat the pain, and there can be treatment at home with the pain medication. Acetaminophen is the most important non-steroidal anti-inflammatory, and aspirin are to be avoided. And in cases of severe dengue, as mentioned earlier, the hospitalization is important. So we also do the positive tourniquet test, and some warning signs could be actually people living in the endemic areas. And laboratory investigations include low white blood cell count, which is typical of a viral infection, and low platelet and metabolic acidosis, severe dengue leading to plasma leakage, and hypoalbuminemia, pleural effusion or ascites, as mentioned, dengue shock syndrome, and of course testing it out for the serological IgG and IgM for dengue virus. So, coming to the prevention and control, this is again very important as mentioned, because what we need to do is to control the mosquitoes and the breeding of the mosquitoes. So all storage tanks, etc., with water, stagnant water, needs to be taken care of, and of course, wearing the long sleeved and covering your body with proper the clothing is important, so that it prevents the mosquito bites, and of course mosquito nets and window screens, the mosquito repellents including DEET, picaridine and IR 3535, and some coals and vaporizers. So remove the mosquito breeding sources, so that the egg laying in these habitats is prevented, and disposing of the solid waste properly is very important as well, and the domestic waste storage containers need to be checked on regularly, and the outdoor water storage containers. So if you get dengue, essentially you need to rest and plenty of fluids, acetaminophen, and avoid NSAIDs, and that is ibuprofen and aspirin, and watch for the severe symptoms and report immediately. Oral rehydration therapy, IV fluids, blood transfusion is important. Vaccines have come about. Dengue vaccine has been used and licensed in several countries. However, it is only between 6 to 16 years of age in high transmission settings. So the others are under evaluation. The WHO, of course, is responding accordingly by supporting the countries which have had these outbreaks, and also providing technical support and guidance for the effective management of these outbreaks. And of course, the reporting systems have to be developed. Even in India, the government has got a program, the disease surveillance program, which is under the National Rural Health Mission, so which provides epidemic response to the disease, and of course training for the clinical management and vector control, and providing evidence-based strategies and policies. There's a global vector control response 2017 to 2030, which is for dengue prevention and control, and the Global Arbovirus Initiative from 2022 to 2025. And so various new tools have been developed and are being incorporated in all the member states of the WHO, and of course publishing and providing the handbooks for the prevention and control of dengue virus. And I thank you very much for this patient hearing. Thank you.